For the most part, we think of mental illness as happening to someone else, despite statistics that claim 1 in 5 or sometimes even 1 in 4 Americans will have a diagnosable mental illness this year. We rarely think of those affected as our neighbours, our workmates, our bosses, perhaps even our own family members. Throughout this Mental Health Awareness Month, KCPT has been focusing on the issue with a series of films. Lost Minds exposes the mental health crisis through the eyes of Kansas City police.
This is definitely an individual we don't need out sitting at a bus stop with other people.
In the first 6 months of this year, KCMO police took nearly 1,300 calls regarding people who are suicidal. On average, that's around 7 per day.
It's Just Anxiety follows the rising numbers of Americans with symptoms from excessive worry and fear to paralyzing panic attacks.
I used to be so much fun, and I used to want to go out all the time and have such a drive to be near people, and I don't want to be near anybody anymore. I don't want anybody to see me how I am now.
And over the last hour on KCPT, you've been watching All These Flowers, a local story about the stigma, maltreatment and labeling associated with bipolar disorder.
I hate using the word delusional, but really in my thinking I was delusional.
I was just gone from reality.
Started having racing thoughts. It was almost like I was God. You believe extraordinary stuff about yourself because you feel extraordinary.
This half hour, we bring the community together to pick apart the most pressing issues and trends facing the mentally ill in our metro. Hello, I'm Nick Haynes. With us are 10 voices in and around the area of mental health. There is a cop, a psychologist, an advertising executive, parents, teenagers. You'll meet them all along the way. Meet first Sean Hess. He is head of the Kansas City Police Crisis Intervention Team. Sergeant Hess, the last time we saw you was during our documentary Lost Minds, where you're seen tracking people with mental illness on the streets of Kansas City. I saw the recent statistics that 1 in 4 of the calls coming in to the Kansas City, Missouri Police Department are mental health intervention calls. Really?
Yes, sir. That's correct. When I went through the academy, we didn't have any training in mental health. I remember going on my first call, and it was quoted back then as a mental call. And I was asking my training officer, what should we look forward to? What do we plan of action? And the attitude was, well, we'll just wing it when we get there. And sadly, for many years, a lot of law enforcement departments just did that. They winged it. And but now, coming forward, crisis intervention teams are the standard. And for departments that don't have a mental health team or crisis intervention team, they're looked down on of like, wow, you really don't. You need to get one of those. So it's out in the forefront now. And we're constantly updating our training. Just this year alone, we're doing 2 hours for all law enforcement in Kansas City on de-escalation, interacting with the mental ill, just as a refresher.
Now, one of the big concerns for the police was when you meet somebody on a call and there is a mental health issue involved, what do you do with them? And in the past, it was, do they belong in jail? Do you send them to the emergency room? Well, back in October, Kansas City, Missouri, launched a brand new center that could now house for the first time with about 16 beds to stabilize people for a 24-hour period. Stephanie Boyer, you run that facility. Are you filling all those beds every night?
Pretty close. And the weather's getting warmer. We're starting to see a spike. So this will be our first summer. So we'll see what that brings.
Are the people who are coming in the same people you expected to see when you launched the center back in October?
I think there's been probably a couple of populations that we're seeing continually increase that we weren't necessarily expecting. We expected to see them, but maybe not to the quantity. And that would be young adults, 18 to kind of 24. And then an increase in elderly population. And specifically, we've been seeing quite a few more elderly people suffering with dementia.
Sergeant Hess, what happens if there is no space at the Crisis Assessment Center downtown?
We still have the emergency rooms and emergency departments. What Stephanie in the Crisis Center really does give us a front door to take somebody now. Before, it was just the emergency rooms, and that's not really the appropriate place to take somebody in a mental health crisis. And her place is so much better prepared, and they fill the gaps in the services that a lot of times when they get out of the EDs, they don't have. When they leave her place, they have the meds and a follow-up appointment.
Emergency rooms, perhaps like at the doors of KU Hospital. Lee Norman is Chief Medical Director there. Do you see these men and women who police simply don't know what to do with, Dr. Norman?
Oh, absolutely. We feel that about 60% of patients that ultimately get hospitalized, even when it's not on our psychiatric unit per se, that 60% of our inpatients have concomitant mental illness along with whatever the physical ailment is.
We were on a public health panel together, and you said at that time, more than pneumonia, more than heart attacks, more than stroke, more than gunshot wounds, more of the cluster of cases you see at KU Hospital is mental illness.
Yes, if we look at our top 25 reasons that people come in, the cluster of mental health illness is number one, and it's been that way.
But yet you're not a psychiatric hospital, so how do you respond to that?
Well, we have a psychiatric unit, and we have other psychiatric facilities, Marillac and KVC, but a lot of those patients are not there for their mental illness. It is just concomitant along with their physical ailment. So what we find is a difficulty putting patients on routine medical surgical units when they have significant, oftentimes, underlying mental illnesses.
What effect does this have on the staff and the medical teams at KU Hospital?
It changes dramatically. It's a lot of the patients have tendencies to violence, and we have lots of staff injuries. We have to staff completely differently. We put what we call a constant observer at the bedside. That's there 24/7, 365.
Well, that's the perspective from a major medical center here in our metro that sees people at their worst. What are our psychiatrists and psychologists seeing around the metro? Psychologist Dr. Linda Moore is being inundated with patients seeking her help. Dr. Moore, you've been at this a long time. What is different about the patients you see today than when you first started your practice?
I had a fairly quiet private practice about the last 20 years, seeing executives and business people and people just wanting to work on issues that had to do with work. And probably in the last 6 months to a year, I've had more and more emergencies, and they've typically been overdoses of prescription medication, alcohol, hospitalizations, and that's a huge peak. To have that shift take place in a short amount of time is a little shocking.
What do you account for that?
Another wave of disconnect in our culture would be the best way for me to think about that. That I've had some kids who are 18 to 25 whose parents had no idea that they were having any difficulty. So that breakdown in communication, no one that you feel as a kid or a young person you can talk to, even if that's not true, it feels that way. And so it's a disconnect and a lack of understanding about what kids are needing or what young adults are needing or what actually any of us are needing, to be seen, to be heard, to be able to share who we are. I think that's very hard for almost all of us, regardless.
Some cases can be too tough to fix in a psychologist's office. Next, meet Clara Gamargo, whose 24-year-old son was diagnosed schizophrenic. Her story was recently featured on the front page of the Kansas City Star. Do you recall the headline about how more than 1,000 mentally ill people in Missouri and Kansas are now being housed in nursing homes because there is no psychiatric hospitals with beds available? Clara's 24-year-old son is being held at a nursing home 4 hours away in Hannibal, Missouri, part of what the Star calls a broken mental health system that increasingly relies on nursing homes with secure wings to handle mental illness is most difficult cases. Clara, that was a very difficult story to read when I saw that in the Kansas City Star. First of all, what has been the response since that story ran?
Oh, I've had people contact me saying that they actually learned a lot from that news article and that they didn't know a lot of the things that were happening and why are people going to nursing homes. And people have talked to me about how their friend or their relative has actually had dementia and thought they were at someone else's house, and the police get called and they get injured because nobody knows how to really handle that.
Greg from Grandview emailed us at KCPT with this question: what better alternatives can be implemented to replace warehousing the mentally ill in nursing homes where they're heavily medicated but only lightly treated? But firstly, is your son getting treatment or is he just being secured in the nursing home, Clara?
He's secured in the nursing home and he's also being medicated. He actually asked for talk therapy, which has not been provided yet. It took about 3 weeks for me to get in contact with someone at the institution because they were not responsive to emails and things like that and phone calls. And finally, I have written permission to talk to somebody, and I've asked and requested that he has talk therapy, but I do not have an update because I emailed again, and I have not heard back.
The Kansas City Star got a huge amounts of comments on that story when it first ran. A lot of them, though, were about, it was a lot of looking at the problem, but very little focused on the solutions. What would you actually like to happen to people like your son, who you had said yourself in the story, you know, you feared for your own safety, so you were concerned there. But what would you like to actually happen in a case like that?
Everybody right now is voluntary. So anything that you want done, you have to volunteer for treatment. You have to volunteer to go to these places. You have to actually follow up with your doctor's appointments. And what seems to happen is that, like with my son, he would start to go, at the very beginning stages, he wanted help, and he would go to Rediscover and things like that. After a while, he started becoming resistant. He said he didn't like the way the medications made him feel, things like that. The staff knew that he was having problems, but they kept saying, our hands are tied due to the laws. We cannot keep him, and we cannot force him to come. He was actually 18 at the time, so I could not force him to come because he is now an adult.
Yes. And you can't force someone to take medication, isn't that correct, Stephanie?
That's correct, yes.
And I think, to me, the problem is that there needs to be, the law enforcement sees these people kind of unravel. I think the community centers that are helping the people see these people start to unravel. There needs to be a place where they can say, okay, we see that this person has tendencies for violence. We see that the person doesn't have, you know, is not medication compliant, and that we need to bring them together in some way.
So, Sergeant Hess, these are not isolated cases, then?
Oh, no, no. We have repeated contacts with people over and over again, and she's absolutely right. We see what's going to end up is that they start decompensating, and you have to get to that level where they're in imminent danger to self or others before we can involuntarily commit them for that 96 hours.
Clara, thanks for sharing your story with us, by the way. This half hour, we are connecting the dots on how the issue of mental health is playing out across the metro in broad and often unexpected ways. We began by talking about the impact on police. But increasingly, one of the biggest impacts is in our schools, which increasingly is playing a frontline role.
Some of you cared. None of you cared enough.
For area school districts, the latest concern, a TV show.
13 Reasons Why tells the fictional story of Hannah Baker, a 17-year-old high school student who takes her own life. Hannah leaves behind 13 cassette tapes where she narrates the events leading up to her suicide.
Hey, it's Hannah.
The Netflix drama 13 Reasons Why is prompting school leaders from Shawnee Mission to DeSoto to send warning emails to parents.
Among the concerns cited is the very explicit way Hannah's suicide is shown in the final episode.
Pardon me, but you really hurt my feelings.
Some psychologists say it glorifies suicide. Others worry it could lead to copycat behavior. The National Association of School Psychologists advised teenagers who suffer from suicidal thoughts not to watch at all, saying it may lead impressionable viewers to romanticize the choices made by the characters.
The show is the subject of the latest installment in our Common Ground series. We head out into the community to examine hot-button issues over a cup of joe. For a unique perspective, we travel to Johnson County, where we brought together the family and friends of Ryan Hill. 4 years ago, the Olathe North High School student had just celebrated his graduation when he took his own life.
I have Netflix, obviously I can watch it, but it's not something that, that I can actually watch mentally. I think for so long that suicide was just kind of a taboo, and that just gets pushed under the rug, or if it happens, you try to keep it quiet or whatever. At least the show is actually talking about it. It's making people talk about it.
It goes back to that stigma for, mental health treatment. No one's going to go, hey, I need mental health treatment. Right. I mean, just walking in the door or making that phone call is really difficult. And so the more we can make that be like not a big deal, just like going to the doctor or the dentist or something else, the better.
Obviously, I'm like Dustin, I haven't watched the show and don't think I could. But just from things that I've read and heard about it, the one negative, I guess, is that they seem to make it appear that suicide was a solution. They really need to stress that suicide is not an option, and that there's got to be a bunch of other stuff that you could do first, and that is just not one of them.
I kind of think it also could just be 13 reasons why not, you know, because there's never a reason that suicide is the ultimate answer to a question.
Common Grounds is a project of KCPT and Consensus, putting the public in public policy. What makes this series so popular, though, with teens?
I think it's because it shows a side that most teens are very scared to talk about in general. It puts us in a position where we can see how we're feeling, like if we are having those feelings, and see how someone else dealt with it, and see how it affects everyone else around them after she made that decision.
Vanessa Ramirez, what has been the response in your school to the series?
In our culture, it is something very taboo, or something that if we don't talk about it, maybe it won't happen, right?
Landon Ginther, you're at Rockhurst High School, which experienced a suicide just last month. How is this playing out, this series at Rockhurst?
Our administration prefers just to not talk about it. It's something they stay away from. But it's being from an all-guys high school, like it's typically thought of that you keep your emotions to yourself, just in general. And we have a lot of retreats to help students be able to like bond with their fellow classmates and be able to talk about what they're feeling. But typically, it's just not something that happens in our hallways. If you think somebody's sad, it's not something you'd pick up on typically. So it kind of just goes under the radar.
Are people actually talking about the series at school, though?
No, not usually. Yep. Usually, if they are, it's just a conversation between friends. There's no active like participation in discussions about the topic. And even having a suicide last month, we did have like a small mourning period, but then after that, we just move on. There's not much more discussion of it.
How did that make you feel?
It kind of desensitizes you to it, not completely, because it is obviously a major tragedy, but once you've only spent like a brief period on it and then you move on, it feels like you might be used to it at some point, and it sort of just makes you forget about it after a month.
Dr. Moore, you're shaking your head there.
I can't think of many things that make me feel more crazy than what he just said about how an administration is handling something, or about the stereotypical male-female differences in handling emotion that is very reinforced in our schools, our education, even politically. So it hurts my heart to hear that these young men are wandering in the hallways and have no one to talk to, which is emphasizing what Vanessa is saying as well. So we have to get our hands around that.
Steve Arkin, for you, suicide is not just a drama series. It is something that was very real in your life. You lost your son to suicide this very week 2 years ago. He was away at college at the time. He died in his dorm at Northwestern University 5 days before his 21st birthday. But you never hid from this. In his obituary that appeared in the Kansas City Star, it read, Jason struggled with clinical depression and ultimately passed due to his illness in a time when mental illness remains, quote, stigmatized and misunderstood. Why was it so important to you and your wife to be so public about that, even in the obituary?
We made a decision about 2 days after he died, and after we learned that the administration at his school decided to actually lie to his dorm mates about the reason that he died. And we struggled with Jason for about 9 years with respect to his mental challenges, and we wanted to honor his life and his legacy in a way that was proactive. Both my wife and I are neurologists, and we really understand the disease process, and that this is not a decision of the people that are involved, but more of a brain telling them what to do.
You were very clear about that too. Your wife, both of you neurologists specializing in disease of the brain, both had the knowledge, the resources, the energy. We had access to the best medical care possible, you and your wife say, but it can happen to anyone.
It certainly can happen to anyone. It was the depression, the anxiety, the perfectionism that wouldn't allow him to see beyond the day. And that is what took him in this entirety. So we decided that we had to educate people that it can occur at any time to any person in any place.
erasing that stigma has become now our life's mission. How are you doing that, Steve?
What we are doing is we are bringing a program of awareness to teenagers in high schools and in middle schools to understand the processes that are involved in depression, to have people that live with mental illness to be able to talk about it to people without wondering about the repercussions of having that conversation. It cannot be put to the backside, thrown under the rug. It has to be put out into the open.
Well, one way you're trying to erase that stigma is through a brand new teen mental health awareness campaign being launched at 14 area high schools. Bernstein Rain Advertising, designing and creating all the campaign materials pro bono, which of course means free. Mark Miller, Vice President and Creative Team Leader at Bernstein Rain, is with us. Why is it this is so important to you to be part of this, Mark?
Oh my gosh, I mean, and this is an issue that affects, if it doesn't affect our families directly, it affects somebody we know, it affects a neighbor, a friend, maybe a colleague at work. And I think in Bernstein Rain's DNA, we've always had this compassion to help causes that help support children and teens and try to make a difference in our community.
This is called the UBU campaign. What are you actually doing?
You know, teens in high schools don't talk to people my age. We were fortunate. We had a group of interns in last summer, and this is between their junior and senior year of college, and we gave them this assignment. We said, look, we want to craft a message in the high schools that actually touch this high school audience in a way that can make a difference. Help us figure out how to do that. You're closer in age to them than we are. And so the UBU campaign really came out of discussion groups, with focus groups, with high school students. And so what we learned is that what the kids really wanted is just to be heard. Kids aren't broken. They may be different. There may be things going on in their lives. There are a lot of peer pressures. They're hard on themselves. They have a lot of expectations. So our campaign is all about trying to affirm the individual.
So what do you want the result to be? Having gone through this with 14 high schools, as 10,000 kids.
What we hope is that the campaign touches a teenage student who might be going through these issues, might be having a friend who's going through them, and maybe they just start to see themselves a little differently and understand that people understand, that the school understands.
Landon, Richer, Vanessa, we're showing some of the images on the screen over here. What do you think of a campaign like that in your high school?
Just immediately, they do jump me out as relatively teen-friendly. The UBU message is something that sort of has been coming up recently, and I personally believe in that thought of UBU and be proud of who you are and be yourself. So I feel like it could be extremely successful when implemented correctly.
Steve, your son, Jason, suffered from clinical depression and was diagnosed at the age of 12. Do you really believe an earlier intervention could have made a difference?
We know from studies that people who have mental illness that suffer, if they are recognized early enough, that the treatments can be more effective. We tried and we worked with him for many years, going through different medications, different psychologists, actually magnetic stimulation through the brain. And I believe that if we can incorporate not only the medical treatment, but also the community socialization and understanding of what these illnesses are, that we can get to these children earlier so they can tell people that they are affected so they can be treated earlier.
We got a question from Jan in Merriam who asks, how is uncertainty over the Affordable Care Act impacting the treatment of mental health? We're hearing a lot right now about the physical aspects of the Affordable Care Act. Does anybody have an answer to that question?
It isn't just with the Affordable Care Act, but across insurances, a lot of mental illness and mental health care is carved out. So, but some of the physical ailments are very much better funded. Mental illness is way underfunded.
We see the same thing as well as substance use. We're seeing continued decrease in available coverage for people for mental health and substance use.
I had an allergist email me, my allergist, saying, you know, allergies is a pre-existing condition. Call your congressman. He's worried about that hospital visits are no longer going to be covered any longer. How about Dr. Moore? Will a visit to Dr. Moore be covered if you have an underlying, you've already been seeing a psychologist? because mental health would be considered a pre-existing condition?
I want to go back even further, because when I owned Centerpoint, a clinic that was very successful in dealing with insurance and treatment, when managed health care came into being and Missouri was identified as an experimental managed health care state, all of a sudden, all of our insurance payments for mental health went way down. And my view is it's been going that direction ever since.
Thank you very much. 10 different voices, 10 different perspectives on mental health in our metro. If you're considering suicide or need help, the National Suicide Prevention Lifeline has someone to listen to you 24 hours a day, 7 days a week at 1-800-273-TALK. If you're tackling a mental illness or are concerned about someone close to you, 24/7 help is available from the National Alliance for the Mentally Ill. Their helpline is just 11 digits away at 1-800-950-NAMI. I'm Nick Haynes. Thanks for joining us.